Hi. Thanks to the COVID-19 epidemic and the unprecedented lockdown, doctors, clinics and hospitals are virtually empty. There is a tremendous interest in using telemedicine to access patients and to provide them with consultations from home. However, a lot of hospital managers and doctors are wondering which is the right telemedicine provider for them. How can I be legally safe? Is this the right solution for me? In this video, I will share with you from my 20 years of experience in using healthcare technology in hospitals to tell you how to choose the right telemedicine provider. Basically, when you are choosing the telemedicine provider, there are two areas that you are trying to balance. One, usability and ease of use, and the second is your legal security. You need to balance between the two. Now, under the legal security or being legally safe, there are certain things that you have to be careful about. The first one that comes to my mind is security of the access to the medical record. Ideally, the medical record should only be accessible by the patient or by the doctor and should be password protected, and the system should be using internationally accepted security protocols to prevent the data being misused by somebody else. That is point number one. The second thing that we have to look out for is storage of your prescription. Number one, the prescription should be available to you as and when you need it. And the second part is it should not be editable by any other entity. This prescription will save you, doctor, from any future legal issues and will help you to mitigate your legal liability. So this is very, very important. As far as the prescriptions themselves are concerned, you have to ensure that the system gives you and provides proper legally valid prescriptions. Now, what is a legally valid prescription? This prescription should have your name, number two, your qualifications, number three, it should have your registration number, number four, it should talk about your address. It should also have your scanned signature. And last but not the least, this is a good thing to have, which I always tell doctors to have, is a disclaimer at the bottom which says this prescription has been generated on the basis of history and seeing patients' reports. The patient has not been physically examined. Now, if a prescription like this comes out, you are legally safe from any liabilities that may arise out of this consultation. So this is as far as your security is concerned. Please choose wisely. Do not sacrifice your legal security on the altar of either cheap or on the altar of usability. Now we come down to usability. When we talk about usability, we are saying that the system should be easily usable, not just by yourself, but also by the patients. So registration, number one, number two, ability to book, number three, ability to pay, number four, ability to upload reports, and for you to be able to do a consultation. All of this should be easy. Ideally, a teleconsultation should mimic a live consultation, a consultation that happens in your clinic or in your chamber. That's the way it should happen. Please ensure that when you're looking at usability, do not sacrifice it or compromise on the security. There are a lot of companies out there which are selling highly usable solutions, but they are leaky. So that is important. The third aspect that you should look into when you are choosing a telemedicine company is the company itself. Two parts there. One is the company stable. Has it been there for a long time? Is it just a fly-by-night company which has come and which will disappear and will leave you stranded? The second thing is, do they have a business model which is financially viable? See, where are they going to make money from? In case this is a free service or they are saying that this is a ridiculously cheap service, that's a warning signal, because then probably they will make money by misusing your data. So anything which looks free or ridiculously cheap may come at a heavy cost to you. So be careful. Be careful. I would also like to say that the Board of Governors of Medical Council of India have recently published a guidelines for doctors on how to use telemedicine. I urge every member, every doctor and hospital manager to go through those guidelines to make yourself familiar with what is the requirement there. In case you have any problems, you can always contact us on this number 9013-543-543. Please practice safely, please be wise, choose carefully, and my best wishes for you.